Welcome back. Daniel in Bradley, California. You're on the air with Wendell Potter.
Hi, Wendell and Tom. How are you today?
Fine, thank you.
Hi, Brad.
It's Daniel.
Daniel.
Oh, I'm sorry.
I mean Daniel in Bradley. That's okay.
Uh-huh.
I'm on Medi-Cal, which is California's Medicaid, and I know our Medi-Cal here is already stretched to the bare bones. I mean, they've canceled almost all dental benefits for adults. You know, I'm going to have to pay $2,500 out of pocket, and I'm on disability, just to get my teeth fixed. And, nobody can afford that. So I'm wondering, with all these people being added to the Medi-Cal rolls here in California, how are we going to afford the coverage we got, much less restoring the coverage they've already taken away?
Coverage, keep in mind that the current access to dental care is terrible throughout the country, and it's one of my main issues is to try to improve access to dental care. The Affordable Care Act doesn't do nearly enough, and the states are not doing nearly enough. And there's a great connection between oral health and overall health. So that is a big, big issue that we've got to focus a lot of time, and I myself will be doing that over the course of the next several months. But keep in mind that the expansion of the Medicaid program in those states that are expanding, and ultimately those that are not, but eventually will, the federal government will be paying 100% of the cost of the Medicaid expansion in the early years. And then it will always be at least 90%. It will never go below 90%. So it's not a huge obligation at all. In fact, in the first year, it's no additional obligation. And there are elements of the Affordable Care Act that will begin and already is beginning to bring down the cost of care and the cost of the federal program. So it will not be an additional burden on the state of California or the expanded Medi-Cal or Medicaid population in the beginning years, and it always will be subsidized by the federal government by at least 90%.
Okay, Mike in Kansas City, Missouri. A quick question for Wendell Potter. You're on Free Speech TV on Dish.
Thank you very much, both of you, for today. I really appreciate that. Thanks. The question that I have is I'm 68 on Medicare, and I maintain a supplemental insurance policy for the extra, as my wife is in the same situation. Will we maintain this supplemental after the implementation of Obamacare, or will it be needed?
You probably will want to continue your Medicare supplemental policy because Medicare, as you well know, doesn't cover 100% of all your medical needs, and that's why a lot of people do get via supplemental policies, and I think that will continue to be something that a lot of people will want to continue. Ultimately, I think we should get to the point that we have something like an improved Medicare for all kind of plan. It'll be some years before we get there. I think it's inevitable that we will eventually. But until we have an improved Medicare plan, I think that...
But Obamacare doesn't basically replace or supplement Medicare at all. So if somebody's on Medicare, nothing changes for them, right?
That's right, except some additional preventive care benefits, which is important.
So there's some additional benefits if you're on Medicare as a consequence of Obamacare, but they're nothing that you have to go sign up for or anything like that?
That's correct. No,
okay, so they're just automatic. These are just, changes in the healthcare system that come about as a consequence of Obamacare. Okay, Wendell Potter with us. We'll be right back with more of your questions for Wendell.